Do you know what has changed since COVID-19 was reclassified to Category 5? And also, how to correctly interpret the results of antigen tests and ways to prevent the spread of coronavirus infection. And let's also take this opportunity to brush up on the effects of vaccines. What kinds of effects have actually been confirmed, even if it's something you feel you can't ask about now. So, this time I've made a comprehensive review video as an update on the novel coronavirus. Please watch until the end. Now first, please take a look at this table. The text is a bit small, but this shows what changes have occurred since COVID-19 was reclassified as a Category 5 infectious disease. On the left side is how we dealt with COVID-19 before it became Category 5, and on the right side is how we handle it now that it's been reclassified. Since complete reporting has been discontinued and cases are now only counted at sentinel sites, we can no longer know exactly how many COVID-19 cases are occurring. Previously, the government designated or arranged hospitals to handle hospitalizations, but now there is nothing like that at all. Basically, every hospital has to handle cases on their own. I think that's the situation we're in now. And until now, there were legal restrictions like requests to refrain from going out, but now there aren't any, right? Also, regarding the cost of treatment, it used to be free, but since it was reclassified to Category 5, patients now have to pay part of the cost themselves. By the way, vaccines were also publicly funded, but under Category 5, they are no longer covered by public funds. However, as a special measure for COVID-19, in fiscal year 2023, the cost is still covered by public funds. So, the two main things that changed with the reclassification to Category 5 are these. The request to refrain from going out was removed, and now it's up to individual judgment. However, of course, that doesn't mean you can't spread it, so there are still recommendations to refrain from going out. For example, you're advised to stay home for 5 days after symptoms start and wear a mask since you can spread it for up to 10 days. Those are the current recommendations. And the concept of close contacts has also been eliminated. Until now, the law specified who was considered a close contact and how long they should be isolated or stay at home, right? But now, there are no such requirements. If possible, if you think you've had close contact, you should isolate yourself, and since symptoms can appear within 7 days, you should carefully monitor your condition during that time. Such recommendations have been made, but there is no legal obligation. However, there is something very important. Even though it has been reclassified as Category 5, some things have not changed. That is the nature of the novel coronavirus. Even now that it has been reclassified as Category 5 and there is no legal obligation, many hospitals are still taking similar precautions against COVID-19 as they did before the reclassification. Why is that? It's because there are many high-risk individuals in hospitals, and since the nature of this coronavirus hasn't changed, if it is transmitted to high-risk individuals, it can cost them their lives. Unfortunately, this is not a rare occurrence. So, in order not to unknowingly transmit it to important people around you or to high-risk individuals, I think it's very important to know the infection prevention measures to stop the spread of the novel coronavirus. With that in mind, I'll briefly explain the routes of transmission for the novel coronavirus. There are two main routes of transmission for COVID-19. The first is inhaling the coronavirus. The second is what's called contact transmission. This happens when you touch your mucous membranes with coronavirus contaminated hands and become infected. And the way the coronavirus spreads is a bit different from viruses we've seen before. Most common colds are spread through what's called droplet transmission, where you get infected by inhaling droplets from coughs or sneezes. But the novel coronavirus is said to be even more infectious than that. Usually droplets from coughs or sneezes fall to the ground within about 2 meters, but with the coronavirus they can travel even farther. That's why it's so easy for outbreaks to happen with this virus. In Japan, this is sometimes called aerosol transmission, but internationally, including by the WHO, the term aerosol transmission isn't really used, so this time I've referred to it as inhalation. And you also need to be careful about contact transmission. Surprisingly, people touch their faces a lot. Things like rubbing your eyes, wiping your nose, or resting your chin on your hand and touching your mouth. Because of things like that, COVID-19 often spreads, so please be careful about that as well. This image shows aerosol transmission. On the left, droplet transmission is shown, where infection occurs by inhaling droplets from coughs or nasal discharge, which are water covered. Due to the effect of gravity, about 2 meters is the limit, and on the right side you have airborne transmission, also called droplet nuclei infection. This is common with diseases like measles, tuberculosis, and chickenpox. These particles continue to float in the air. They are highly infectious. The novel coronavirus has an infectiousness that is right between droplet nuclei infection and airborne infection. Please keep that in mind. Also, let's make sure to understand the general progression of symptoms for the novel coronavirus. After being exposed to the coronavirus, the incubation period is said to be about 3 days. After 3 days, symptoms begin to appear, and then symptoms reach their peak about 3 days after that. At this time, the amount of virus in the body also peaks. Please note that even if you get tested right after symptoms appear, the test for coronavirus may not actually come back positive. I'll explain the details next. Also, regarding the coronavirus, how many days are you actually contagious to others? As a general guideline, it's about 10 days. The amount of virus usually decreases after 10 days. By the 11th day, the amount drops to about 4%, and it's said that the chance of infecting others is low, so the period to be careful is about 10 days. I think it's good to remember it that way. Now, let's talk about some important points regarding the COVID antigen test. Have you all ever taken an antigen test? It's the same with the flu. You know that painful test where they stick a swab deep into your nose? Actually, if you take that test on the first day, you have a fever. Even if the result is negative, you can't rule out COVID at all. Even if the test result is negative, there are many people who later turned out to be positive. In terms of percentage, about 42% of people who take the test on the first day they have a fever actually have COVID, but the test result comes out negative. So just because you get a fever and take an over-the-counter antigen test on the first day and it comes out negative, thinking, "I'm not infected with COVID," is a mistake. By the way, if the antigen test is positive, in most cases you can be pretty sure it's COVID. But even if it's negative, that doesn't necessarily mean you're not infected. Please remember that. Now please take a look at this image. This shows the trend of COVID cases this year. The data only goes up to August, but even though these are sentinel surveillance reports, you can see that the number of COVID cases has been steadily increasing. Now that COVID-19 has been classified as Category 5, what kind of measures are necessary to prevent its spread? Please take a look at this image. The visible part of the iceberg above the water represents people who tested positive for COVID-19. However, what's important is that since it became Category 5, I think many people have stopped going for tests. There are also people who are infected but have no symptoms, or those who have a fever but don't think it's serious enough to go to the hospital. It is believed that there are actually many more people who have COVID than what is being reported. So what's important to prevent the spread of infection is not so much isolating those who are infected, but rather that everyone should practice basic infection prevention measures. That's the important approach. There are people who haven't been diagnosed, haven't been tested, or don't have symptoms, but could still spread COVID without it being detected. To avoid catching it from such people, and to make sure you don't spread it yourself, let's be mindful of standard preventive measures. Things like washing your hands, practicing proper cough etiquette, and keeping social distance when necessary. Try to avoid crowded places, and remember that your basic precautions might save the lives of people at high risk. Isn't it good to think that way? I'd also like to touch on the importance of wearing masks. When it comes to whether masks are meaningful or not, there are various opinions, but basically, the data shows that it's better for everyone to wear masks in order to reduce the number of infections. And regarding the idea of masks, let's think of it not as wearing a mask to avoid catching something from others, but as wearing a mask to avoid passing something on to the people you care about. There was a mask study conducted in Massachusetts, USA. Some schools said it was okay not to wear masks early on, and other schools had everyone wear masks, just like during the COVID-19 pandemic. When you compare them, it's clearly the latter. The people who continued to wear masks had fewer COVID-19 cases. This data also shows that while some people feel uncomfortable or can't wear masks in situations where large groups gather or when you have to talk at close range, I think it's better to wear a mask in those situations. Of course, please make your own decision after considering everything. Next, I'll introduce the ventilation methods recommended by the Ministry of Health, Labour and Welfare to prevent the spread of COVID-19. Basically, try to do natural ventilation once every 30 minutes by opening windows on opposite sides of the room to let the air flow through. And it's said that carbon dioxide monitors are effective. We breathe in oxygen and exhale carbon dioxide. So if carbon dioxide accumulates, it's an indicator that the air is stagnant. For those who want to take thorough infection control measures, a CO2 monitor can serve as a useful reference. Mechanical ventilation systems, meant to run 24 hours a day, are sometimes shut off in some places, which is often overlooked but common. Basically, to prevent the virus from filling the air, you need to create airflow and keep mechanical ventilation running 24 hours a day. Don't forget to keep the ventilation fan on. Here are some guidelines for ventilation. Open windows or doors on opposite sides of the room to let the air flow through, but it's not enough to just open any window. Please take a look at this image. If you only open 2 windows at the corners of the room, the air won't circulate throughout the entire space, so there will be areas where the air becomes stagnant. As a solution for situations like that, you can place an air circulator like this, so that the incoming air moves throughout the room and escapes through the window. You can create that kind of airflow, so please try to make a point of using fans or air circulators. And finally, let me touch on the effects of the vaccine. There are various effects being discussed, but I think it's rare to see them organized and explained like this, so please remember this. These are the proven benefits of the COVID vaccine. It can help prevent infection with the coronavirus and also prevent the onset of symptoms. However, these effects decrease over several months. Rather, the most important thing about getting the COVID vaccine is its ability to prevent severe illness. It is said that this effect lasts for about 6 months, so for people who are high risk or have low physical strength and might be seriously affected if they get infected with COVID now, for those people, I think it's a good idea for them to get vaccinated. And as another benefit, the vaccine also helps strengthen immunity. It can also lower the risk of things like stroke or heart attack and reduce both the number and severity of symptoms that remain after getting COVID, known as long COVID. On the other hand, one thing that doesn't change is that even if you get vaccinated, if you catch COVID, the period during which you shed the virus is about the same as for people who haven't been vaccinated. Please keep those things in mind as well. How was it? This time I gave you an update on the coronavirus. What has changed since it became Category 5 and what hasn't changed? How should we think about testing? What infection control measures are effective? And I gave a brief explanation about the vaccine. Well then, I'll see you again in the next video.